Hi everyone, I'm Dr. Nick Kastner. I'm a resident here at Stony Brook Dermatology. If you're watching this video, it's probably because you have some sort of interest in this program for your residency, and you may have some apprehensions. It's very difficult to learn a lot about residency programs just from preliminary reviews of websites and whatnot. And in fact, when you match, you're not even going to have that great of an idea even of where you're going. Many people match at institutions that they've never rotated at. I was in the same boat just a few years ago, being a native Floridian. I had never been to Stony Brook other than when I interviewed here, but when I showed up, I was very lucky to find myself in a very well-rounded program where we get to work with 4 different Mohs surgeons and get to see a little bit of everything, surgically speaking. We work with 3 great dermatopathologists, and we work with 2 great pediatric dermatologists who all very frequently contribute to our education here. That being said, the well-roundedness is great, but the thing that's the best about this place is that everybody here has not only helped foster my interests, but has encouraged me to pursue those to the furthest along my journey here at Stony Brook. I would encourage you to weigh that heavily in your consideration of your future programs. Best of luck to you along your route. We hope to see you one day at Stony Brook.
Hi, I'm Doug Metzidis, and I'm the current Chief Dermatology Resident here at Stony Brook University. So as I was looking for dermatology programs in the middle of applying, I knew that I wanted to have a diverse array of experiences in terms of my dermatology training, and Stony Brook offers really everything you could want from a full program, including extensive medical dermatology exposure, surgical, dermatopathology, and pediatric dermatology. All of our faculty members are extremely supportive, and they really allow for graded responsibility throughout the years that you're here. And they also really encourage you to take on more autonomy as well. And it's nice, the bond and rapport that you get to form with the different faculty members. And our mix of exposures both at the VA and at our Stony Brook sites allows for great diversity of patient experiences. So we get a lot of surgical experience at the VA along with a lot of medical dermatology, and then through Stony Brook we of course add to more medical and surgical, but then we also get our derm path and our pediatric dermatology exposure. So as someone who came from a medical school that involved training at a VA, that was something I was looking for particularly in order to take care of the veterans. And this program kind of fit the bill perfectly for what I wanted from my training, and I honestly couldn't imagine myself at another program right now. In terms of the area, so I grew up in New Jersey, so I basically moved from one suburb of New York City to another. But while I've been here, I've been very pleasantly surprised by how nice it is in Suffolk County. There are many beaches and parks, so I frequently go on walks in the parks on the weekend. And among some other things, there are lots of really good restaurants and movie theaters, and even there's a jazz club that's in Stony Brook itself, if that's something you're interested in. But overall, the general vibe of our practice is very collegial. The residents, we get along really well, and all of our faculty members like to make us feel welcome from day one. There's not one bit of antagonism, and our exposure has just been, our experience here has only been positive, and I would recommend it to anyone who's looking for a complete, supportive, and kind of transformational experience as you transition from being a medical student to a board-certified dermatologist.